This is One on One. We are honored to be joined all the way from San Francisco, a compelling author, a pediatrician, an entrepreneur, someone who's making a huge difference in the lives of so many children across this country. She is Dr. Nadine Burke Harris, and the author of a compelling book called The Deepest Well, Healing the Long-Term Effects of Childhood Adversity. Good to see you, Doctor.
It's very nice to meet you. Thank you.
Doctor, let me ask you this book, your message. You gave a TED Talk back in, it was released in 15? Mm-hmm. You got a lot of reaction in response to it. You wrote this book about adverse childhood trauma, if you will. Mm-hmm. What have you seen as a pediatrician?
I've seen a lot. I've seen, the reason I wrote the book is because for many children, kids were being referred to me saying, please, I think they've got ADHD, attention deficit hyperactivity disorder. He needs Ritalin. Can you put him on some medicine? And as a doctor, when I investigated how early adversity affects the developing brains and bodies of children, what I found was that for most of the kids I was seeing, Ritalin actually wasn't the right prescription. And it was really a result of their body's normal reaction to the abnormal experiences that they were dealing with. Things like domestic violence or having a parent who's mentally ill or substance dependent, these things that are common, but they are really harmful for kids' development and well-being.
Short and long term for these children.
Yes, that's absolutely
right.
Talk
about that, because some of your colleagues have talked about, and they kept referring to your keynote and how you would be the one to be able to explain this, but short term, there's obvious, well, I shouldn't say obvious, there's certain effects, but long term, you're talking about heart disease, you're talking about cancer, and that was shocking to me that there's a correlation. There is.
Yeah, so understanding that when we talk about the effects of early adversity, I think for a lot of us it makes common sense that if you have a rough childhood, you may be more likely to, drink and smoke or have, end up with depression or other mental health or behavioral conditions. I think the thing about this research from the CDC and Kaiser Permanente showing that high levels of adverse childhood experiences can double your risk for heart disease or stroke or dramatically increase your risk for Alzheimer's, right? That for a lot of folks was like, what? That's not about bad behavior. That is, what is that about? And for me as a doctor, it has been a fascinating journey of uncovering how it is that early adversity leads to increased risk of all these different health problems.
We are, with our production company, doing a series called Right from the Start, and it's funded by Nicholson and the Terrell Fund and some others. 0 to 3. What we're talking about, these traumatic experiences, this toxic stress, if you will, 0 to 3 as well. Happens to those children, no?
Absolutely. And in fact, a lot of people think that, my child was too little. He doesn't remember, and therefore it probably didn't affect him. And what we now know is that those earliest years, the 0 to 3 time period, is a time of what we call critical and sensitive periods in brain development where these harmful experiences can have an even greater impact on long-term health and development.
During that period?
During that period, yes, that's right. And so helping kids have a healthy start right from the beginning is absolutely critical in preventing these long-term effects. In fact, what all of the science is showing us now is that early intervention improves outcomes. So when we start from the very beginning, right, and really that means starting with parents, raising awareness, having this conversation that having adversity in childhood can lead to an overactive stress response, right? What we call the toxic stress response. And that can lead to lots of health problems down the line. But you don't have to hand down your adversity to your kids. There's actually a tremendous amount of healing that can happen. And that's what I have dedicated my professional life to, and our organization, the Center for Youth Wellness, is really working on raising national awareness and helping clinicians have tools to be able to address toxic stress in children.
To what degree is this a national crisis?
Oh, this is a public health crisis. Across the United States, we're talking about almost 35 million children at risk for toxic stress.
35 million.
That's right.
Is it, I want to get the numbers right. I know there's a report that's coming out next month with more details on this. Is it 1 out of 4, or is it close to half? I mean, how many are we talking about?
So when we're talking about individuals who have been exposed to at least one adverse childhood experience, we're talking about 2/3 of adults.
2/3 of adults.
2/3 of adults. And when we're talking about the number of folks who have been exposed to 4 or more adverse childhood experiences, which is really this very high threshold where we see double the risk for heart disease, 2.5 times the risk of stroke, triple the risk of chronic lung disease, that's 1 in 8 Americans. So this is not, some small problem that only happens in certain folks or in certain communities. In fact, this research, when it was originally done by the CDC, was done in a middle-class community, 70% Caucasian, 70% college educated.
It's so interesting. By the way, the reference is obviously, if you're not following, to the Centers for Disease Control. What I'm curious about is, say you're talking about our national political discourse, discussion of leaders in our nation. I might have missed this, but I've been doing this for a few years. I've never heard one major political figure talk in detail about any of this. Is it something they don't know about?
Well, more and more, I think our political leadership is being awakened to this issue. In this June, actually, I was invited and gave testimony at a congressional hearing about the issue of toxic stress when the issue of separating kids from their caregivers at the border was
as an immigration policy, right?
Exactly.
This is part of, that is what you were, another example of what you're talking about.
Yeah, so what the science shows us, right, is that when stressful or traumatic things happen and they activate a child's stress response, the way that we buffer the child's stress response is with safe, stable, and nurturing caregiving relationship. Essentially having a loving parent or caregiver or relative to be able to do that. So when we have kids who have gone through adversity, who are coming to our country as refugees because of the trauma that they're leaving, and then we set a policy of separating them from their caregivers, we're literally putting their health at risk. And in fact, what we saw was that individuals who were in the Japanese internment camps had double the rate for heart disease.
During World War II?
Yes, that's right.
Double the rate.
Double the rate of heart disease. And so at this point, as a nation, we have to understand that once we know this science, we can't unknow it. And we must use it to inform our policies. And when we have policies that knowingly inflict physical harm, right, by separating children who are at the peak of vulnerability from their caregivers, that can lead to long-term medical risk, for me, it was critical to be able to speak out at the Senate hearing.
Doctor, I want to thank you for joining us here in New Jersey. From San Francisco, your message is powerful nationally. It'll be very much part of our Right from the Start and J initiative, and I want to thank you for taking the time to speak with us.
Thank you. It's my pleasure.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, Wells Fargo, Atlantic Health System, New Jersey Sharing Network, the Russell Berry Foundation, and by Seton Hall University. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.